Hello friends, I'm Dr. Vibha Babbar. Today I'm going to talk about what causes halitosis or bad breath. Do you suffer from bad breath? If yes, you are not alone. Studies shows that 50% of individuals have halitosis or bad breath in their lives. Bad breath is a very common problem patients want to get addressed when they are in the dental office. Do you know why? Because halitosis can be embarrassing, and in some cases, it can also affect your personal or professional lives. So, what do you think is the most common cause of bad breath or halitosis? Any guesses? What did you all say? Garlic? No, it's not garlic. Oh, I hear some saying onions. No, it's not onion. Although these foods don't help and cause some amount of bad breath, so in reality, the most common cause of bad breath is the oral microbial flora, that is the oral bacteria. Actually, microflora is a combination of hundreds of bacteria in our mouth. I do not wonder when I go into the stores and see the shelves overflowing with different kinds of gums, mouthwashes, and other products designed to fight bad breath. But many of these products are just a temporary relief for bad breath because they do not address the root cause of the problem. Do you know 90% of the bad breath originates from the oral cavity, but 10% of bad breath originates from nasal passages, lungs, or digestive tract. So what are the major causes for bad breath? So let's see. Morning breath. Oh yeah, bad breath in the morning is very common. This is because saliva production in our mouth nearly stops while we are sleeping. And if you sleep with your mouth open, the bad breath is worse. Second is you don't brush and floss. Actually, yes. Failure to brush and floss leaves a lot of bacteria in between your teeth, causing accumulation of bacteria on the remnant of food. I get many patients who ask why do they have bad breath while they are still brushing every day. But when I ask them if they're flossing, they say no. Do you know 40% of the teeth surfaces are left untouched if you're not flossing. That is a large percentage of missed surfaces that has smelly bacteria in your mouth. Actually, these smelly bacteria act on our food particles and produces volatile sulfur compounds that causes a severe bad breath. Third, it's the periodontal disease, or what you guys call gum disease. Bad breath is one of the main symptoms of gum disease or periodontal disease, which we call as perio breath. So if you do not brush and floss daily, a colorless sticky film called plaque accumulates on your teeth. And if that is not brushed away, it calcifies and it starts irritating the gums, and eventually it starts causing tartar-filled pockets and causes periodontal disease. This condition needs immediate care by an oral healthcare professional. Next is cavities. If you have bad breath, you do not necessarily have bad cavities, but it is possible. Cavities are caused by the destruction of the tooth surface caused by the bacteria in the mouth. These bacteria live on leftover food particles in our mouth and produce acid which eat away our teeth surfaces. Next is GI or stomach issues. Yes, you heard me right. It's not always the mouth that causes the bad breath. Poor digestion, constipation, acid reflux, GERD, or bowel disorder all can cause bad breath. This is big. Dirty tongue. If you're not cleaning your tongue, in that case, you are leaving behind a lot of bacteria in your mouth. Most of the odor-producing bacteria are found on the back of our tongue. Tongue has fissures. Some patients have deeper fissures than the others, and the bacteria harbor in these fissures, if not cleaned properly, and cause malodor or halitosis. The other one is dirty retainers, aligners, or dentures. Retainer, aligners, and dentures, if not cleaned properly or they are ill-fitting, they will retain a lot of food particles and bacteria harbor in them. So anytime you're wearing your retainers or aligners or dentures, you will start having bad breath if they're not cleaned properly. Next is tobacco products. Tobacco has its own unpleasant, ashy smell. Smoking, tobacco chewing, and vaping all causes tobacco smell. Moreover, smokers and oral tobacco chewers are more likely to have gum disease or periodontal disease, which causes bad breath. Next is pregnancy. Pregnancy is not a reason for bad breath, but nausea, vomiting, morning sickness is very common in pregnancy. All these causes bad breath. Also, due to hormonal changes in pregnancy, patients have pregnancy gingivitis that leads to bleeding of the gums and bad breath. So in pregnancy, you should never think about missing your dental appointments. Your dentist is there to help you. In addition, due to hormonal changes, craving for different kind of foods and dehydration causes changes in the microflora and may cause bad breath. Next is food. Yes, now it's here. After you eat food, bacteria get to work in your mouth, and those bacteria produces volatile sulfur compounds that causes bad breath. Eating certain kinds of food, as you guessed earlier, like garlic, onion, and some spices, causes you bad breath after you ingest them, and they go into your bloodstream and are carried to lungs and cause you bad breath. Moreover, bad breath is common in people who are missing their meals, fasting, or are on special diets like keto diet or juice diets. Because in those diets, your fats are broken down into ketones, and which causes ketone smell or bad breath. Another common reason is dry mouth. A condition called dry mouth or xerostomia can cause bad breath. Saliva helps to clean our mouth round the clock. And if you do not produce enough saliva, your mouth is not getting cleaned. Next one that's coming up is alcohol. Alcohol consumption is another culprit for bad breath. More often you drink alcohol, more likely you are going to experience bad breath. Also, drinking alcohol causes dry mouth, which does not let enough production of saliva and causes bad breath. Next one is medications. Hundreds of prescription medications causes dry mouth, which causes bad breath. But some medications are broken down in our body and produce chemicals that cause bad breath. And there are many other mouth, nose, throat conditions. Bad breath can occasionally stem from your tonsils in the back of your mouth. In patients with immunocompromised conditions, yeast infection can cause bad breath. Respiratory tract infections like pneumonia, bronchitis can cause bad breath. Diabetes and chronic lung infections can cause bad breath. Liver and kidney problems can cause bad breath. And some cancers and metabolic disorders can cause bad breath. Tract infections like pneumonia and bronchitis, long-term sinus infections, diabetes, chronic lung diseases, liver and kidney problems, some cancers and metabolic disorders. So friends, I hope you find this information helpful and useful, and hopefully you can modify your oral hygiene habits and your dietary habits to improve your breath. Don't forget to discuss your problem with your dental professional and come to the root cause of the problem to get appropriate solution and treatment. And if your dentist is unable to find the reason for your bad breath, your dentist will guide you to see your physician for further evaluation. Thank you all for watching my video.